Hello, I'm Danielle Sturm. I'm Marketing Communications Manager for the New England Medical Innovation Center, otherwise known as NEMIC. We do these MedTech talks in partnership with Venture Café Providence monthly, where we highlight local innovators, startups, companies, industry leaders working in the MedTech and digital health space, by giving them a platform to share their stories and trending topics and information that will pretty much holistically help grow the MedTech ecosystem and support other innovators develop and commercialize successfully. Today, our guest host is Jeff McCloud, the Director of Digital Design at Thrive, a product development and innovation strategy firm based in Atlanta, Georgia. And Jeff has been working on advising and teaching workshops at our current digital health accelerator cohort, and the information he has been sharing has been very imperative to the success of these local startups within the accelerator. So I'm very excited to introduce you to Jeff and introduce our topic for today, which is how COVID-19 has accelerated user experience design in MedTech. Thank you, Jeff. I'll turn it over to you.
All right. So yeah, we were just talking as we're going up into this, that pretty much everyone by this point is kind of sick of talking about COVID, right? We're going into year 2 of this pandemic. So, there's a lot of things that I don't need to tell anybody here that has a massive impact on both the society and the economy and healthcare. And this has had some really long-term effects. Although it was short term, it's been sustained over going into year 2 now. So from a lot of impacts going from just general med tech and also in digital health, we've seen some radical shift in terms in a short amount of time to really kind of focus more on a lot of unproven technologies that have since been proven over the subsequent year going into year 2. So just to kind of remind folks, and I'm not going to show any case numbers or anything like that, everyone's kind of sick of that by this point. Let's talk about some high-level statistics. So what actually happened over this period of time? So as the pandemic started, the first 2 weeks, we had a massive shift from in-person care visits with their clinicians to virtual visits. And that happened 4,300% in 2 weeks. Think about that for a second. That was just a massive scale of, virtual telemedicine has been around for a decade now, or longer than a decade. And all of a sudden you have this huge surge of activity that people are going to get care. So tremendous amount of numbers. So even going through this after year 2, going into year 2, we have still 21%, so a fifth of American adults have experienced some level of high-level psychological distress. So a lot of really resurgence and really need to address mental health issues, even going through as a sustained pandemic as we're kind of coming out of it. And also, unfortunately, we've also had, due to a lot of restrictions in diagnosis, over a plan, or they actually estimate 10,000 excess deaths just from breast cancer and colorectal cancer alone. Those were because they were delayed in the diagnosis and treatment of these things. So pretty life-changing things. So these statistics, while powerful, and we've kind of seen a lot of statistics coming out of the pandemic, they don't really paint the picture very well. So let's go and take a look at the pandemic through the eyes of these 3 pseudo-personas. So we have Cecilia, Dr. Rodriguez, and Marcus. So let's follow them on their kind of view of going through this on throughout the year. So first off, let's go meet Cecilia. She's an older adult with a chronic disease. So her overall experience as going into the pandemic was the inpatient visits that she really went to several times a month are now all virtual. And now she's interacting with multiple HCPs, but her health literacy and her technological literacy are a little bit limited. Not to mention that she has a ton of bandwidth issues in terms of her internet. So a lot of this interaction with her patient, with her provider, is really, really frustrating and often drops off. Not to mention she has to go through multiple different care portals in a very confusing way, and then read these notes in using languages that she really doesn't understand. So she ends up having to have multiple messages back to her and forth from her provider to really understand whatever care plan is. all this frustration has really caused her to really kind of take a step back. She's had some weird and concerning symptoms that she has yet to talk to her clinician about. So she's going to wait till that's over, and she's going to do it in person. So this is kind of really one of the major things we're seeing, just general confusion, and the health inequities that we're seeing from patient levels are being exacerbated by this change. Next, let's talk to her provider. So her primary care physician is Dr. Rodriguez. So let's talk, she has Cecilia as one of her patients, but all her encounters have shifted to virtual too. And Cecilia is just one of her caseloads. She's actually had a significant amount increase of patients in terms of her care load. And as she's doing this, she's going through more, and she's still doing analog. The patient, all the notes are handled by her notepad, and she has to spend hours and hours afterwards to log all that. And also, people like Cecilia, who don't have a lot of health literacy, have a lot of questions, and she has to make sure that she catches up with them. She doesn't necessarily understand the prescribed care plan, and she has to really actively manage her care fatigue and her decision fatigue as she's going through this. And then let's meet Marcus. So Marcus is a father working from home. He had a pretty big shift in terms of working in person to working remotely. And up to the pandemic, he had a little struggles with depression, but this has been exacerbated with it. It's really been very tough on him. But after some conversations with his friends and family about depression, since it's become destigmatized, he's really started to take steps towards getting help and care for his mental health issues. But it wasn't quite as easy having conversation, although people were talking about it more. Trying to find the right balance of apps and things like that as he searched the web weren't really up to par. They really kind of they didn't quite have the same level of consumer experience that he interacts with on a daily basis. He didn't really feel the need. So he had some problems navigating, and then disappointed by the overall apps experience himself. So why are we talking about these personas from these lenses? These people don't exist, right? So these people are not real, but their stories are powerful tools in talking about the larger trends. So Cecilia, she is using that persona to really talk about the shift in changing point of care. So not just from the pandemic, this is going to be a lasting shift in point of care. Similar to this virtual experience we're having now, that experience with your provider is going to be shifted and be sort of a hybrid model going forward, or time will tell for that. But it still has to have considerations for care inequities. So health literacy, health numeracy, technological literacy, and also technological capabilities of internet connections. And also it highlights the point of the treatable is now untreated or has been untreated, and it's going to have long repercussions going forward from the pandemic. Dr. Rodriguez is really highlighting the point of that rapid shift to remote care and how much more information are we getting from our clinicians. As a clinician, we're getting from our patients, and also from that patient-provided information. What is the value of all that information? How do I make sense of that? What is the most important way to do that? And that leads to care fatigue, because I have to have all the things because my technology stack doesn't work with my workload. I have to go and do that afterwards, which adds extra time and inefficiency, which all kind of ends up due to burnout if you don't manage it effectively. Marcus is our kind of beacon for how the destigmatization of mental health, which actually happened before the pandemic, has really kind of come into its own going forward. But there's still a bumpy path ahead, because navigating the care plan and expectations for that are really high. The consumerization of healthcare is real in terms of interactions and overall sensitivities to how my data is going to be shared, and the expectation of it has to look this high for me to trust it, regardless of the information I'm going to do that. And this also kind of balances out the recalibration of lifestyle. There's been months and years of new habits been phased out, phased back in. How's that going to impact society going forward? So why we use these as designers is to really kind of highlight the overall experience and make that translate a lot of the qualitative research that we do into a design input, so we can really understand how people are using, and then help that drive the product development sequence. process. So from this kind of process, we would actually go and conduct really highly qualitative, highly in-depth research with individuals to really understand the nuance of why things happen, or understand their motivations and their abilities and their perceptions, from health industry on to, I just like that. And in order to translate those into stories, we use a lot of personal stories of these people, of these pseudo personas or actual real personas, to really, really make those experiences and stories come to life and resonate with us as individuals. We're not designing features here. We're designing stories and tasks for them. So as you take these stories and put them into the design process, it really understands the workflow, how they're using it, why they're using it, and really what is the value and proposition, what are they really looking for? And so it makes sure that it aligns to their, it's intuitive for them to be useful, but then also has a clear need and assigns to brand and business objectives as well. And make sure that information is concise, clear, and actionable to aid in the decision-making process. But as we first go into it, let's talk about what user experience is as a definition. So user experience, and we define that as Strive, is the process of designing a product that is usable, intuitive, provides value to the user, and enhances the experience of interacting with the product, service, and brand. So this is something that we've really seen enhanced by, or focused more on the pandemic, as all these issues and all these technologies are tried real time with at scale during the pandemic. Now, this process is not simply just from a design perspective. There's a team sport. So we have to have human factors and marketing and software development, engineering, all those team parties involved with that process. And that process looks like at a high level is a discovery phase, understanding that qualitative aspect. What are the opportunity areas? Going into exploration and concept development and iteration, testing, and being able to create lots of different solutions, refining that, and finally making that real in codification, in development and deployment of products. What that discovery process requires a lot of contextual inquiry, talking to people, really understanding their nuances behind that, not just the people's aspects, but also client and secondary markets and the whole entire landscape of what that looks like, and really balancing that out in terms of an objective to develop and create new new product development. And then we want to do through concept explorations, a lot of iteration, a lot of new ideas, and going through that process of very quickly and creating, testing, designing, developing, and then repeating that process until we have a good concept direction going forward. Then further development of the user experience in terms of wireframe development, the paths going through it, the organization of the application, really kind of refining what that visual tone is, what that copy, what that language is, how does that align to health literacy and tone, and also building prototypes and developments to really understand what kind of things can we use to help shape behavior, help nuance that. How do we help people take control of their health and remind them to do things that are appropriate that they want to do? And then kind of tying it up and saying, how do we make this, okay, now we have this concept and we've developed it. How do we design a system for this and future other products? Are there specifications around the colors in terms of visual design? Are there icons? Is there motion? And how is that motion detailed out? So it can be codified and developed and made real into the product that can be defined at scale. Next, as we go through this process, there's a lot of nuances that are coming from and pressure coming in from the pandemic, even pre-pandemic, on terms of MedTech process. So let's take a look at really what MedTech had some exacerbated by the pandemic. So we had a lot of interesting pressures on that. So increasing expectations in terms of to develop elegant, easy to use products, onto the threat of recall. That's real in terms of user experience. That's tremendous. It can impact patients and also impact the bottom line. So it's tremendously important for MedTech. On to making sure that technology is being commoditized. Everyone has that particular technology. How do we make a difference? That's through user experience to make that experience different. And then also be able to, complexity of the product development, the time to create these products is increasing. But then at the end of the day, you have such competition that the product lifecycle goes down. And then also there's a lot of brands that are just not keeping up with the times because of extremely changing user expectations and experience expectations. So let's take a look at how other industries have kind of looked at user experience. So let's look at the tech industry. So the tech industry has obviously been at the top of the food chain in terms of market, but they've invested heavily in user experience design. Actually, if you break it out by employee from Apple, it's $1.8 million in revenue per employee focused on user experience development, on down to Facebook and Apple at 1.5 million. Still pretty significant. So it's pretty clear that they wouldn't be at the top of the food chain had they not invested in user experience. Now, from a strategic benefit, going back into the MedTech realm, let's take a look at the value across the whole spectrum, from the end user benefit onto the strategic benefits going across MedTech. From the strategic benefits, we really have a lot of good companies that are invested in UI and UX in terms of 200% over the last 220% over the last 10 years in terms of S&P. So it's really had an increased demand on revenue, allows for premium pricing, and has some competitive barriers and differentiation. From a financial benefit, we have a lot of good ROI from a Forbes article saying there's a 9,000% ROI for investment in UI to really reduce the development costs and timelines, increase sales, and really kind of limit the amount of rework. Speaking of rework, we can have the operational and cultural benefits really kind of focus on making the right product versus making the product right. So this allows for acceleration to time and market and reduces the development time to up to 33 to 50% according to Experience Dynamics. And then the end user benefits, good user experience builds brand and user advocates. So if you take the example from Nokia, back in the 90s, and they were the defining moment of everyone had a Nokia phone. But what happened? All of a sudden, they didn't invest in the user experience design, and Apple and Google did. And it really kind of took the lunch. And where are they now? They're not in anywhere even in a conversation. So let's talk a little bit more about the trends we talked about earlier, kind of coming back to it. So this shift in points of care. So now it matters it's no longer the realm of early adopters. It is the de facto standard. If I need to get something even post-pandemic as we're coming out of it, it's very something that could be happening as a new way to interact with my client or with from my provider, from my patient and my provider. And this now needs to be more considerate at scale of people with health inequalities in terms of bandwidth or health literacy and numeracy, and also technological literacy. So where UX has been accelerated by this is to simplify a lot of these hard to use programs and platforms, really kind of focus on those inequalities from a tech and health literacy perspective, and to really be able to, at the end of the day, get out of the way, not design the experience, but really kind of focus on that interaction between the provider and the patient. And then also work from a provider's perspective, work to actually integrate note-taking and all the documentation you need from a regulatory perspective into that workflow so it doesn't add vital time to the end of the day. Then we have mental health care platforms. So this is really focused on getting awareness and interest of those mental health issues, but there's a lot of platforms and experiences and demand for these to expand access to services. So the importance of UX design is design the experience that looks credible and is trustworthy, but then is also accessible. How am I going to be used? How am I using my information? Is it going to be used in a very way, in a responsible way? Is it going to be secure and trustworthy? And be able to design these care platforms in a way to accelerate how they're designed, but then also maximize the therapy sessions, so they really kind of shape behaviors and really make that vital impact and give the end user the care that they need to get better. And you also want, and more importantly, be able to navigate this complex system of mental health to get the right care that they need on the right platform to really kind of balance out their overall preferences. And then the consumerization of healthcare. So the consumerization of healthcare is something that we've seen all over the place. So people have really seen this shift from both from a patient perspective in terms of expectations, also providers. They really don't have any tolerance to really put up with bad experiences from healthcare experiences. They want to have good experiences that are from a visual design, from an interaction, and even or a data perspective that helps them really do what they need to do with the product, and not lack of trust of the information if it comes from a poorly designed experience. So from a UX perspective, accelerated by this is to define and extend the best practices for interaction patterns. So really kind of looking through appropriate interactions that we see from the consumer world, leveraging those. So since we're spending so many hours out of our day on technology devices, we have expectations of how things work. How do we take those into the healthcare realm, the MedTech interactions, and pull those in so it works intuitively, it works like social media, it works like that, to make sure that it fits within that structure, but it doesn't really, it has the credibility of MedTech on top of that, rather than having something that's poorly designed that actually takes some of that credibility out. Also, as we're going through this, we want to consider the context of use of where they are when they're using this. Are they sitting at home? Are they talking to their clinician? Are they taking a virtual care visit at the grocery store because they don't necessarily think about that? How do we balance that out and make sure that those experiences are appropriate for those experiences, appropriate to the situation for both parties? And then also balancing the right level of information. So how much are you seeing information? More data is not better data. Actionable data that's presented in a way that I can make clear and concise messages from that is really important. And so this will all establish the best interaction patterns that are familiar, intuitive, and be able to consider the context of use in terms of the right information to make the right decisions. So let's take a look back at our folks here that we kind of revisited at the beginning. So Cecilia, Dr. Rodriguez, and Marcus. So from a design path forward, we've kind of taken this as a story. We've gone through some of the user experience processes, values, and how that's kind of changed over time. We have kind of this as a thought starters for each one of these different people. So what do we take from this? So how do we get Cecilia what she needs? How do we get Dr. Rodriguez what she needs, and Marcus as well? So Cecilia, what we're really kind of, one way we can consider this in terms of creating a user story is virtual care visits that consider my abilities and inequities or inequalities and make it easy to use so I can actually have the care experience that I need. And Dr. Rodriguez is being able to have application that aligns my workflow to align better documentation and regulatory requirements. So I don't have to spend 20 hours extra per week documenting all this information. And I can spend the time on patients and interacting with them in a way that's most meaningful to them and optimize their care rather than working with paperwork and documentation. And Marcus, being able to have a consideration for a consumer grade or consumer level mental health experience that connects me to the care that I need, I trust, and it really fits within his lifestyle on his terms that really shapes his recovery from his depression. So each one of these are really kind of have a potential outputs of where this might go. Hopefully this has shown some interesting trends on how the pandemic has accelerated the importance of UX. So I'll open up for questions. So I appreciate your time.
I have a question about a kind of user. I was thinking about this as you were going through, and with all the misinformation around medicine and medtech, and especially the vaccine and all these kinds of things that are on social media, how does that impact then how you think people are going to view a virtual doctor's appointment, or like, do you think that's going to negatively impact how people intake this kind of serious information if they're getting it from the same source for them, the computer? It didn't occur to me until you were going through all these like scenarios, and I was like, wait, but people don't trust like what they read on the internet right now, or they're.
Yeah, that's a really interesting point. I think that's partly due to like false information is just more exciting than real information. You know, like, hey, isn't that crazy? I can't believe it. It's very compelling, very shareable. But then it also kind of speaks to some level of the credibility and consumerization, because I'm interacting with content like on social media. The interface and the user experience is transparent. I'm actually looking at Facebook or Instagram or Twitter or whatever I'm on, or Snapchat. I'm looking at the content and I'm viewing that content from the lens. So the design of it is kind of invisible in a certain sense. And a lot of the stuff from terms of healthcare, it's very visible. It's so visible, it kind of gets in the way. It feels clunky. It's like, I have to press this button and this button, and you have to like look at the interface. It's looking at the interface for having an interface. And because of that interface, it feels a little bit less exciting, because you're looking at the interface, you're looking at the information through that interface, and the information is less important just because you have this thing around it that's kind of informing this kind of clunky nuances. So I'm not saying that there is necessarily, people think that doctors are less credible because of virtual care, but it definitely doesn't help. And especially if I have a poor internet connection and I'm connecting with them, and all of a sudden they drop off and I have to go connect, I'm not going to blame my internet connection. I'm going to blame them, because that's part of that overall experience. So
Right.
how I can classify all that experience together and optimize it for the lowest common denominator in terms of internet speed and ability and technology, I'm not going to be able to get that experience out of the way. I'm going to have this big clunky experience that I'm going to judge my overall care by.
Yeah. And it seems like right now, at least, that it's a lot of insurance companies are kind of pushing for more, which, we all know that just complicates things and adds more layers in between doctors and patients. But they seem to be pushing for more virtual because it's easier whereas before COVID, they weren't pushing for virtual at all and we're trying to slow it down. Now it seems like they're pushing it forward because they're finding it easier, or I don't know if that's even true, but that's the perception. But like, I don't know, I dropped a comment in the chat as you're talking, because I really love the idea of virtual appointments, but I'm a millennial, like I'm almost a digital native, and my grandparents, on the other hand, like they're going to be in that pool where they're not going to ask questions of their doctor because they're uncomfortable with the tools and the systems. So like, I don't know. I don't know that as a population, the majority of people are ready for it, but I think it's such an interesting opportunity to embrace it right now and move forward. So I don't know.
It's an interesting idea, because I've also often thought about, just going inpatient, just from personal experience of going in and asking questions from my provider. And I go into them, I'm sitting on a table, and maybe I'm wearing a piece of a smock, or I might be undressed or whatever, and doing that. I'm at it's not on my terms at all. Like, and I'm supposed to ask them questions that's going to impact the rest of my treatment, like for the rest of my life. And it's kind of, I don't know, it's too much, but maybe in, my own bias of also being an older millennial, of being on my own terms at my own house, kind of sitting in my own chair, am I more comfortable in asking those questions that I really need to go? Or do I have the opportunity to, hey, the doctor walked out of the room, I don't have any questions, but now I can actually have the messaging, I can ask them follow-ups if I need to. But do I, if I'm my parents' age or older generations of, baby boomers or the golden generation, am I going to respond to that? Or do I even know how to navigate to the messaging aspects or the aspects in my portal to actually see that in general? Or just see the test results that means, gobbledygook to me. I'm like, how do I do this? Like, I don't even know what that means. Am I good? 0.90 for what? Is that good or is that bad? I don't know.
Yeah, exactly. And I'm constantly like, I'm a blood donor. So every time I get my blood pressure from the donation clinic, I Google it and I'm like, what does this mean that my blood pressure is X over Y? And because that's who I am, I get a number and I'm like, I don't know what this means. I'm going to Google it and see what comes up. But like, obviously, I don't think that would have crossed my grandparents' minds at all. But Toonie has a question. And
this is an interesting conversation. I had a call yesterday with a friend who lives in Massachusetts, and she has been diagnosed with ADHD, during the pandemic, and she had a really great therapist. But in Massachusetts, she said they're no longer, I guess the insurance no longer is covering telehealth for mental health or for her. So she is dropping this awesome therapist that has been really helping her. I just found that interesting. Like, I'm like, really? I thought we were leaning more into telehealth. I just kind of wanted to add that.
Mhm.
Yeah, I mean, there's definitely things that and factors beyond just straight design. Design good design costs money, just like anything else, and you have to have the reimbursements happening at the right appropriate time, and you have to have the right amount of reimbursements for the providers, for mental health, from everybody aligned. The amount of focus on mental health has been pretty significant from a product development perspective, but I don't know if that's quite turned around from the provider's perspective. Or you also have some, organizations and hospitals and things like that. They're now taking the lead and paying for wellness applications themselves. They're not necessarily mental health; they're more on the wellness side. But maybe that relieves a lot of the burden from the payer side to not cover that, since that's partially covered by your own provider or something like that. So it's a pretty interesting space. Is that going to catch up in terms of reimbursements for providers in mental health? It definitely seems that way. But at the end of the day, people want cheaper rates, and people don't want to pay extra for things like that, or folks that have the mental health coverage that might drop off maybe that might impact the ability from the payer to keep that, or what they do cover in terms of mental health capabilities.
Yeah, I was going to bring up this same topic too, because I've had some experience with trying to find new physicians in the mental health space, and all of them have been check with your provider to make sure, one, they still cover telehealth. And most of the time, a lot of the providers I've been talking to, like through personally and through work, they have a limit at I think they're saying December. They're like, okay, we know that we're going to cover telehealth for this till December, but after that it's up in the air. How does a company how do companies strategize with investing in the UX for telehealth, maybe in mental health or not, when you don't really know what's gonna happen in a few months' time?
Yeah, I mean, that's the big question, right? This is a lot of the reasons why you have this current situation of the unknown. And MedTech, there's a lot of companies that are very risk averse. They're not willing to take the big leap in terms of let's make a great experience, let's invest in UX, let's invest in this as a brand and an experience, because we might have this giant unknown. Versus, say, the tech industry, they have a lot more capital, really, and they have a lot more revenue, then they can take those big risks and they can have that mentality of that. But at the same time, you have people interacting with those products for non-healthcare related, and so their expectations. So what is the right balance of getting it here, or are you going to take an extra big risk by doing that if it doesn't even work is from a payer model, or you just migrate over to a different play. So maybe it's not, maybe it's more of a data play, or maybe it's something else to actually go and kind of hedge your bets in terms of investments. There's a lot of different things you can do, but yeah, for sure, there's a significant amount of risk from getting that reimbursement rate of that really makes or breaks a lot of these telehealth and virtual visits, and makes them possible or not.
Mhm.
Al, if you want to unmute, you can ask your question.
Hi, yeah, thank you. This is Alvin Ramsey. Thank you for allowing me to ask this question. I apologize if it was covered before. I was a bit late, but I was very keen on just understanding how much does stickiness apply for a healthcare app UX design. I'm thinking in the context of Nir Ayal. I'm not sure if I'm pronouncing his name correctly, but he's like this very famous guy from Silicon Valley. Talked about how to create stickiness. With very effective for like products like Facebook and things like that. Trying to have the UX experience be, there's some gamification there, like trying to incentivize users to come back and keep using the product over and over again. But in the context of healthcare, like particularly like telehealth visits and things like that, if you have appointments, there's some stickiness level in that because they're invested in their own healthcare. But I'm just curious, like how much does some of that like social media type of stickiness apply to healthcare product UX design? Thank you. That's my question.
Yeah, this if I heard your question correctly, it's how do you have gamification and behavior shaping? How do you integrate those from, say, a social media lens onto from a health lens, and how can you shape that? So, like, just off from a general cost in terms of healthcare, it's about 80% of our overall cost is due to people making poor health decisions. So that's a significant amount of money just because people are not doing what they should be doing. And so can you take that and can you apply some of the shaping to really curb or incentivize or just empower the patients to make the appropriate decisions? And so yes, the answer is you definitely can. It's definitely more nuanced than simply a social media. So Facebook, they've been kind of going through, changes in shaping, social media kind of at scale with live populations versus healthcare. We have to be a lot more nuanced and to run clinical studies and give people informed consent of what they're doing. We want to make sure that we're not incentivizing without their control, and then also be able to, or without them knowing that they're being pushed to a particular direction. So you do want to have more of a goal-based approach and use the theoretical change models that are appropriate for that population. So this is kind of one of those things that we'd want to have strong involvement from their provider to help shape their information. So unfortunately, a lot of the applications that we see on the market now are more on the reminder side. So, hey, take your meds, right? Remind you. But those don't really work too well in terms of, well, yeah, I forgot my meds because I'm driving in the car now and I'm in traffic and I forgot at home. Thanks for reminding me, but I still can't do it. It's not really getting to the crux of the issue of why I don't take my meds or why I don't adhere to my care plan or why I don't do particular ones. And unfortunately, that requires a lot of data. So getting a lot of information to map what they're currently doing as an individual population group, and then being able to use that to predict what they are. So you have a lot of that luxury from a Facebook, from a Google or something like that. Everyone's using, millions of people using this platform on a daily basis, billions even. And you have a ton of how people are really going to interact. So if you don't have that scale from your digital health, you really can't have a baseline to really kind of shape the implication. So it's kind of a little bit of a chicken and egg. You also have to pass through regulatory pathways to make sure that you're doing something that's safe and effective and doesn't introduce more risk. And is that a medical device in itself? Which possibly. And then you have to kind of consider their overall situation of just reminding people that they have a chronic disease condition on a daily basis isn't good. I don't define myself by my chronic disease. I define myself as a patient. I'm an individual. So what's the right balance of being able to shape your behavior or consider your health behaviors at the time when it's important? Is it taking your meds? Is it eating the right thing? Is it doing exercise or whatever it might be? Being able to understand when those moments are, and then really take those triggers and be able to access the triggers to provide some incentive for the user to actually do the right thing for their health, or be able to take on to that understanding of what they're doing. So it's a little bit of need the users, need the regulatory investment, need the clinical studies, and then also the scale of users to make sure that it's actually appropriate for that situation.
That's awesome. Thank you. Al, did that answer your question?
Yeah, no, that was very, very helpful, and I totally concur. It's very important to try to consider the context of how the what the end user would be using the product or service, and instead of like building something and say, all right, this is helpful to the user. We got to be like, all right, let me make sure that this is gonna be helpful for the user at the time that they can use it, and it's like put them in a position where it's helpful, as opposed to getting something like a reminder while they're driving. It's not very helpful. So we kind of have to just put ourselves in all of these different scenarios of the users and just be cognizant of that. That's the responsibility of the the solution provider. That totally reinforces and is a very good reminder.
Excellent. Yes.
Yeah, thank you.